BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 2. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Proximal supraventricular tachycardia is treated with Option A. Furosemide. Option B. Digoxin. Option C. Beta blockers. Option D. Atropine. The correct answer is option C. Beta blockers. Let's go through the options. Furosemide. Furosemide is a diuretic, not an antiarrhythmic. Digoxin. Digoxin acts slowly and is not first choice here. Atropine. Atropine speeds the heart and would worsen it. And the correct answer is beta blockers. Beta blockers slow a node conduction and control the tachycardia. So, the right answer is option C. Beta blockers. Question 2. Pulsus paradoxus is characteristically seen in Option A. Aortic stenosis. Option B. Aortic regurgitation. Option C. Mitral stenosis. Option D. Cardiac tamponade. The correct answer is option D. Cardiac tamponade. Let's go through the options. Aortic stenosis. Aortic stenosis gives a slow rising pulse. Aortic regurgitation. Aortic regurgitation gives a collapsing pulse. Mitral stenosis. Mitral stenosis gives a low volume pulse. And the correct answer is cardiac tamponade. Tamponade exaggerates the inspiratory fall in pressure, giving pulsus paradoxus. So, the right answer is option D. Cardiac tamponade. Question 3. Pulsus alternans indicates Option A. Atrial fibrillation. Option B. Constrictive pericarditis. Option C. Aortic regurgitation. Option D. Left ventricular systolic dysfunction. The correct answer is option D. Left ventricular systolic dysfunction. Let's go through the options. Atrial fibrillation. Atrial fibrillation gives an irregular pulse. Constrictive pericarditis. Constrictive pericarditis gives a paradoxical pulse. Aortic regurgitation. Aortic regurgitation gives a collapsing pulse. And the correct answer is left ventricular systolic dysfunction. Alternating strong and weak beats reflect severe left ventricular dysfunction. So, the right answer is option D. Left ventricular systolic dysfunction. Question 4. Pulsus tardus et parvus is a sign of Option A. Mitral regurgitation. Option B. Pulmonary stenosis. Option C. Tricuspid stenosis. Option D. Aortic stenosis. The correct answer is option D. Aortic stenosis. Let's go through the options. Mitral regurgitation. Mitral regurgitation gives a sharp pulse. Pulmonary stenosis. Pulmonary stenosis does not give this carotid sign. Tricuspid stenosis. Tricuspid stenosis affects the venous pulse. And the correct answer is aortic stenosis. A slow rising, low volume pulse is the sign of aortic stenosis. So, the right answer is option D. Aortic stenosis. Question 5. An irregular pulse indicates Option A. Sinus arrhythmia. Option B. Ventricular tachycardia. Option C. Atrial flutter. Option D. Atrial fibrillation. The correct answer is option D, atrial fibrillation. Let's go through the options. Sinus arrhythmia. Sinus arrhythmia varies gently with respiration. Ventricular tachycardia. Ventricular tachycardia is fast but usually regular. Atrial flutter. Atrial flutter is often regular. And the correct answer is atrial fibrillation. An irregular pulse is the hallmark of atrial fibrillation. So, the right answer is option D. Atrial fibrillation. Question 6. Sudden cardiac death in a young athlete with a family history is most likely due to option A, hypertrophic obstructive cardiomyopathy. Option B, mitral prolapse. Option C, aortic stenosis. Option D, myocarditis. The correct answer is option A, hypertrophic obstructive cardiomyopathy. Let's go through the options. Mitral prolapse. Mitral prolapse rarely causes sudden death. Aortic stenosis. Aortic stenosis is a less likely cause in the young. Myocarditis. Myocarditis is not the familial cause here. And the correct answer is hypertrophic obstructive cardiomyopathy. Hypertrophic obstructive cardiomyopathy is the classic cause of sudden death in young athletes. So, the right answer is option A. Hypertrophic obstructive cardiomyopathy. Question 7. Benz-Jones protein in urine is characteristic of option A, renal cell carcinoma. Option B, nephrotic syndrome. Option C, amyloidosis. Option D, multiple myeloma. The correct answer is option D, multiple myeloma. Let's go through the options. Renal cell carcinoma. Renal cell carcinoma gives hematuria, not Benz-Jones protein. Nephrotic syndrome. Nephrotic syndrome loses albumin, not light chains. Amyloidosis. Amyloidosis may follow myeloma, but this protein defines myeloma. And the correct answer is multiple myeloma. Benz-Jones protein is free light chains, characteristic of multiple myeloma. So, the right answer is option D. Multiple myeloma. Question 8. Hyperviscosity syndrome is most characteristic of option A, Waldenstrom macroglobulinemia. Option B, chronic myeloid leukemia. Option C, polycythemia vera. Option D, multiple myeloma. The correct answer is option A, Waldenstrom macroglobulinemia. Let's go through the options. Chronic myeloid leukemia. Chronic myeloid leukemia raises the white count but not viscosity like this. Polycythemia vera. Polycythemia raises viscosity but is not the most characteristic. Multiple myeloma. Myeloma light chains rarely cause hyperviscosity. And the correct answer is Waldenstrom macroglobulinemia. Waldenstrom macroglobulinemia makes large IgM, causing hyperviscosity. So, the right answer is option A. Waldenstrom macroglobulinemia. Question 9. The commonest leukemia in children is option A, acute myeloid leukemia. Option B, acute lymphoblastic leukemia. Option C, chronic lymphocytic leukemia. Option D, chronic myeloid leukemia. The correct answer is option B, acute lymphoblastic leukemia. Let's go through the options. Acute myeloid leukemia. Acute myeloid leukemia is commoner in adults. Chronic lymphocytic leukemia. Chronic lymphocytic leukemia is an elderly disease. Chronic myeloid leukemia. Chronic myeloid leukemia is uncommon in children. And the correct answer is acute lymphoblastic leukemia. Acute lymphoblastic leukemia is the commonest childhood leukemia. So, the right answer is option B. Acute lymphoblastic leukemia. Question 10. Raised leukocyte alkaline phosphatase is seen in option A. Chronic myeloid leukemia. Option B. Paroxysmal nocturnal hemoglobinuria. Option C. Myelofibrosis. Option D. Aplastic anemia. The correct answer is option C. Myelofibrosis. Let's go through the options. Chronic myeloid leukemia. In chronic myeloid leukemia, the score is low. Paroxysmal nocturnal hemoglobinuria. In nocturnal hemoglobinuria, it is low. Aplastic anemia. Aplastic anemia has too few cells. And the correct answer is myelofibrosis. Leukocyte alkaline phosphatase is raised in myelofibrosis. So, the right answer is option C. Myelofibrosis. Question 11. Honeycomb appearance on chest X-ray indicates option A. Bronchiectasis. Option B. Pulmonary edema. Option C. Emphysema. Option D. Interstitial lung fibrosis. The correct answer is option D. Interstitial lung fibrosis. Let's go through the options. Bronchiectasis. Bronchiectasis gives tram-track shadows. Pulmonary edema. Pulmonary edema gives batwing shadowing. Emphysema. Emphysema gives hyperlucent lungs. And the correct answer is interstitial lung fibrosis. End-stage interstitial fibrosis gives the honeycomb appearance. So, the right answer is option D. Interstitial lung fibrosis. Question 12. C3 complement is characteristically reduced in option A. Post-streptococcal glomerulonephritis. Option B. IgA nephropathy. Option C. Minimal change disease. Option D. Membranous nephropathy. The correct answer is option A. Post-streptococcal glomerulonephritis. Let's go through the options. IgA nephropathy. IgA nephropathy has normal complement. Minimal change disease. Minimal change disease has normal complement. Membranous nephropathy. Membranous nephropathy usually has normal complement. And the correct answer is post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis lowers the C3 complement. So, the right answer is option A. Post-streptococcal glomerulonephritis. Question 13. Diabetic nephropathy is characterized histologically by option A. Crescent formation. Option B. Nodular glomerular sclerosis. Option C. Minimal change. Option D. Membranous thickening only. The correct answer is option B. Nodular glomerular sclerosis. Let's go through the options. Crescent formation. Crescents are seen in rapidly progressive glomerulonephritis. Minimal change. Minimal change is a childhood nephrotic pattern. Membranous thickening only. Membranous thickening alone is a different disease. And the correct answer is nodular glomerular sclerosis. Nodular glomerulosclerosis, the Kimmel-Steele-Wilson lesion, is diagnostic. So, the right answer is option B. Nodular glomerular sclerosis. Question 14. Antimitochondrial antibodies are found in Option A. Primary biliary cirrhosis. Option B. Autoimmune hepatitis. Option C. Primary sclerosing cholangitis. Option D. Wilson disease. The correct answer is option A. Primary biliary cirrhosis. Let's go through the options. Autoimmune hepatitis. Autoimmune hepatitis has anti-smooth muscle antibodies. Primary sclerosing cholangitis. Primary sclerosing cholangitis has PNK. Wilson disease. Wilson disease is diagnosed by copper studies. And the correct answer is primary biliary cirrhosis. Antimitochondrial antibodies are the marker of primary biliary cirrhosis. So, the right answer is option A. Primary biliary cirrhosis. Question 15. Primary sclerosing cholangitis is most strongly associated with Option A. Ulcerative colitis. Option B. Celiac disease. Option C. Crohn's disease. Option D. Chronic pancreatitis. The correct answer is option A. Ulcerative colitis. Let's go through the options. Celiac disease. Celiac disease is not the association. Crohn's disease. Crohn's disease is less strongly linked. Chronic pancreatitis. Chronic pancreatitis is unrelated. And the correct answer is ulcerative colitis. Primary sclerosing cholangitis is strongly linked with ulcerative colitis. So, the right answer is option A. Ulcerative colitis. Question 16. Achalasia characteristically causes dysphagia to Option A. Both solids and liquids. Option B. Liquids only. Option C. Neither. Option D. Solids only. The correct answer is option A. Both solids and liquids. Let's go through the options. Liquids only. Liquids only is not typical. Neither. Dysphagia is present, so neither is wrong. Solids only. Solids only suggests a mechanical stricture, not achalasia. And the correct answer is both solids and liquids. Achalasia causes dysphagia to both solids and liquids from the start. So, the right answer is option A. Both solids and liquids. Question 17. Addison disease is characterized by Option A. Hypernatremia and hypokalemia. Option B. Hyponatremia and hyperkalemia. Option C. Hypernatremia and hyperkalemia. Option D. Hyponatremia and hypokalemia. The correct answer is option B. Hyponatremia and hyperkalemia. Let's go through the options. Hypernatremia and hypokalemia. Hypernatremia with hypokalemia is the opposite pattern. Hypernatremia and hyperkalemia. Hypernatremia with hyperkalemia is not the pattern. Hyponatremia and hypokalemia. Hyponatremia with hypokalemia is not Addison's. And the correct answer is hyponatremia and hyperkalemia. Lack of aldosterone gives hyponatremia and hyperkalemia. So, the right answer is option B. Hyponatremia and hyperkalemia. Question 18. Kaposi sarcoma is most closely associated with Option A. Hepatitis C. Option B. HIV. Option C. Epstein-Barr virus. Option D. Cytomegalovirus. The correct answer is option B. HIV. Let's go through the options. Hepatitis C. Hepatitis C causes liver disease, not Kaposi. Epstein-Barr virus. Epstein-Barr virus causes lymphoma. Cytomegalovirus. Cytomegalovirus causes retinitis, not Kaposi. And the correct answer is HIV. Kaposi sarcoma, driven by human herpes virus 8, is an AIDS-defining illness in HIV. So, the right answer is option B. HIV. Question 19. Rugger jersey spine on X-ray is seen in option A. Osteoporosis. Option B. Renal osteodystrophy. Option C. Paget disease. Option D. Multiple myeloma. The correct answer is option B. Renal osteodystrophy. Let's go through the options. Osteoporosis. Osteoporosis thins the bone. Paget disease. Paget disease gives a picture frame vertebra. Multiple myeloma. Myeloma gives punched out lesions. And the correct answer is renal osteodystrophy. Renal osteodystrophy gives the Rugger jersey banded spine. So, the right answer is option B. Renal osteodystrophy. Question 20. The commonest cause of wrist drop is option A. Ulnar nerve injury. Option B. Radial nerve injury. Option C. Median nerve injury. Option D. Axillary nerve injury. The correct answer is option B. Radial nerve injury. Let's go through the options. Ulnar nerve injury. Ulnar nerve injury gives a claw hand. Median nerve injury. Median nerve injury gives a hand of benediction. Axillary nerve injury. Axillary nerve injury affects the deltoid. And the correct answer is radial nerve injury. Radial nerve injury causes wrist drop. So, the right answer is option B. Radial nerve injury. Question 21. Thromboendarterectomy is most commonly performed for option A. Varicose veins. Option B. Renal artery stenosis. Option C. Aortic aneurysm. Option D. Carotid stenosis. The correct answer is option D. Carotid stenosis. Let's go through the options. Varicose veins. Varicose veins are treated by stripping or ablation. Renal artery stenosis. Renal artery stenosis is treated by angioplasty. Aortic aneurysm. An aortic aneurysm is repaired by grafting. And the correct answer is carotid stenosis. Carotid stenosis is commonly treated by endarterectomy. So, the right answer is option D. Carotid stenosis. Question 22. The best vein for use in arterial bypass surgery is the option A. Short saphenous vein. Option B. Femoral vein. Option C. Long saphenous vein. Option D. Cephalic vein. The correct answer is option C. Long saphenous vein. Let's go through the options. Short saphenous vein. The short saphenous is less ideal in length. Femoral vein. The femoral vein is a deep vein not used. Cephalic vein. The cephalic vein is used for fistulae. And the correct answer is long saphenous vein. The long saphenous vein is the graft of choice for arterial bypass. So, the right answer is option C. Long saphenous vein. Question 23. A Fogarty catheter is used for option A. Urinary drainage. Option B. Draining an abscess. Option C. Removing blood clot from arteries. Option D. Bile duct decompression. The correct answer is option C. Removing blood clot from arteries. Let's go through the options. Urinary drainage. Urinary drainage uses a Foley catheter. Draining an abscess. An abscess is drained by a different tube. Bile duct decompression. The bile duct uses a different drain. And the correct answer is removing blood clot from arteries. A Fogarty balloon catheter removes clot from arteries. So, the right answer is option C. Removing blood clot from arteries. Question 24. The Brody-Trendelenburg test detects. Option A. Deep vein thrombosis. Option B. Incompetent valve at the saphenofemoral junction. Option C. Arterial insufficiency. Option D. Lymphatic obstruction. The correct answer is option B. Incompetent valve at the saphenofemoral junction. Let's go through the options. Deep vein thrombosis. Deep vein thrombosis is detected by Doppler. Arterial insufficiency. Arterial insufficiency is assessed differently. Lymphatic obstruction. Lymphatic obstruction is not tested this way. And the correct answer is incompetent valve at the saphenofemoral junction. The test detects an incompetent valve at the saphenofemoral junction. So, the right answer is option B. Incompetent valve at the saphenofemoral junction. Question 25. A cystic hygroma is a type of. Option A. Lymphangioma. Option B. Dermoid cyst. Option C. Teratoma. Option D. Hemangioma. The correct answer is option A. Lymphangioma. Let's go through the options. Dermoid cyst. A dermoid cyst has skin elements. Teratoma. A teratoma has 3 germ layers. Hemangioma. A hemangioma is a vascular, not lymphatic, lesion. And the correct answer is lymphangioma. A cystic hygroma is a lymphangioma of the neck. So, the right answer is option A. Lymphangioma. Question 26. Union of an uncomplicated transverse tibial fracture in an adult normally takes about. Option A. 6 weeks. Option B. 12 weeks. Option C. 20 weeks. Option D. 26 weeks. The correct answer is option B. 12 weeks. Let's go through the options. 6 weeks. 6 weeks is too soon for a tibial shaft. 20 weeks. 20 weeks is longer than usual. 26 weeks. 26 weeks suggests delayed union. And the correct answer is 12 weeks. A transverse tibial fracture unites in about 12 weeks. So, the right answer is option B. 12 weeks. Question 27. A March fracture results from. Option A. Direct violence. Option B. Avulsion injury. Option C. Localized stress and fatigue. Option D. Pathological bone. The correct answer is option C. Localized stress and fatigue. Let's go through the options. Direct violence. Direct violence causes a different fracture. Avulsion injury. An avulsion is a muscle pull injury. Pathological bone. Pathological bone is a separate cause. And the correct answer is localized stress and fatigue. A march fracture is a metatarsal stress fracture from repeated fatigue. So, the right answer is option C. Localized stress and fatigue. Question 28. Bainate fracture involves the option A. First metacarpal, option B. Scaphoid, option C. Distal radius, option D. Fifth metatarsal. The correct answer is option A. First metacarpal. Let's go through the options. Scaphoid. The scaphoid is a separate wrist fracture. Distal radius. The distal radius is a Colles fracture. Fifth metatarsal. The fifth metatarsal is a foot injury. And the correct answer is first metacarpal. A bainate fracture is a fracture dislocation at the base of the first metacarpal. So, the right answer is option A. First metacarpal. Question 29. A giant cell tumor of bone shows which X-ray appearance? Option A. Sunburst. Option B. Codman triangle. Option C. Soap bubble. Option D. Onion peel. The correct answer is option C. Soap bubble. Let's go through the options. Sunburst. Sunburst is seen in osteosarcoma. Codman triangle. Codman triangle is seen in osteosarcoma. Onion peel. Onion peel is seen in Ewing sarcoma. And the correct answer is soap bubble. A giant cell tumor gives a soap bubble lytic look. So, the right answer is option C. Soap bubble. Question 30. Marjolin ulcer is A. Option A. Melanoma. Option B. Basal cell carcinoma. Option C. Squamous cell carcinoma. Option D. Adenocarcinoma. The correct answer is option C. Squamous cell carcinoma. Let's go through the options. Melanoma. Melanoma is a pigment cell cancer. Basal cell carcinoma. Basal cell carcinoma rarely arises in a scar. Adenocarcinoma. Adenocarcinoma is glandular, not from a scar. And the correct answer is squamous cell carcinoma. A Marjolin ulcer is a squamous cell carcinoma in a chronic scar or ulcer. So, the right answer is option C. Squamous cell carcinoma. Question 31. Glomus tumor most characteristically occurs in the option A. Nail bed. Option B. Scalp. Option C. Sole. Option D. Axilla. The correct answer is option A. Nail bed. Let's go through the options. Scalp. The scalp is not the typical site. Sole. The sole is not typical. Axilla. The axilla is not typical. And the correct answer is nail bed. A glomus tumor classically arises in the nail bed and is very painful. So, the right answer is option A. Nail bed. Question 32. In a modified radical neck dissection, which structure is preserved? Option A. Sternomastoid only. Option B. Internal jugular vein. Option C. Accessory nerve only. Option D. Submandibular gland. The correct answer is option B. Internal jugular vein. Let's go through the options. Sternomastoid only. The sternomastoid is preserved along with others, not alone. Accessory nerve only. The accessory nerve alone is not the answer. Submandibular gland. The submandibular gland is usually removed. And the correct answer is internal jugular vein. The modified operation preserves the internal jugular vein. So, the right answer is option B. Internal jugular vein. Question 33. The uterine artery supplies all of the following except the option A. Bladder, option B. Vagina, option C. Lower cervix, option D. Ovary. The correct answer is option A. Bladder. Let's go through the options. Vagina. The vagina receives a branch of the uterine artery. Lower cervix. The lower cervix is supplied by the uterine artery. Ovary. The ovary receives an anastomotic branch. And the correct answer is bladder. The bladder is supplied by vesical arteries, so it is the exception. So, the right answer is option A. Bladder. Question 34. The blood supply of the vulva is mainly from the option A. Inferior epigastric artery, option B. Uterine artery, option C. Obturator artery, option D. Pudendal artery. The correct answer is option D. Pudendal artery. Let's go through the options. Inferior epigastric artery. The inferior epigastric supplies the abdominal wall. Uterine artery. The uterine artery supplies the uterus. Obturator artery. The obturator supplies the medial thigh. And the correct answer is pudendal artery. The vulva is supplied mainly by the pudendal artery. So, the right answer is option D. Pudendal artery. Question 35. The function of the round ligament of the uterus is to option A. Prevent prolapse, option B. Carry the uterine artery, option C. Support the ovary, option D. Anchor the cervix. The correct answer is option A. Prevent prolapse. Let's go through the options. Carry the uterine artery. The uterine artery runs in the broad ligament, not the round. Support the ovary. The ovary is supported by its own ligament. Anchor the cervix. The cervix is anchored by the cardinal ligament. And the correct answer is prevent prolapse. The round ligament keeps the uterus anteverted, helping prevent prolapse. So, the right answer is option A. Prevent prolapse. Question 36. Amniotic fluid volume is maximum at about option A. 16 weeks, option B. 24 weeks, option C. 34 weeks, option D. 40 weeks. The correct answer is option C. 34 weeks. Let's go through the options. 16 weeks. At 16 weeks the volume is still rising. 24 weeks. At 24 weeks it is not yet maximum. 40 weeks. By 40 weeks it has declined. And the correct answer is 34 weeks. Amniotic fluid peaks at about 34 weeks. So, the right answer is option C. 34 weeks. Question 37. The corpus luteum continues to function until about option A. 6 weeks, option B. 8 weeks, option C. 11 to 12 weeks, option D. 16 weeks. The correct answer is option C. 11 to 12 weeks. Let's go through the options. 6 weeks. At 6 weeks the placenta has not taken over. 8 weeks. 8 weeks is too early for the handover. 16 weeks. By 16 weeks it has regressed. And the correct answer is 11 to 12 weeks. The corpus luteum supports pregnancy until about 11 to 12 weeks. So, the right answer is option C. 11 to 12 weeks. Question 38. Implantation normally occurs at how many days after fertilization? Option A, 3 to 5 days. Option B, 8 to 10 days. Option C, 14 to 16 days. Option D, 20 to 22 days. The correct answer is option B, 8 to 10 days. Let's go through the options. 3 to 5 days. 3 to 5 days is when the blastocyst is still dividing. 14 to 16 days. 14 to 16 days is too late. 20 to 22 days. 20 to 22 days is far too late. And the correct answer is 8 to 10 days. Implantation occurs about 8 to 10 days after fertilization. So, the right answer is option B. 8 to 10 days. Question 39. Quickening is usually first felt by a primigravida at option A, 12 weeks. Option B, 18 to 20 weeks. Option C, 24 weeks. Option D, 28 weeks. The correct answer is option B, 18 to 20 weeks. Let's go through the options. 12 weeks. At 12 weeks movements are not yet felt. 24 weeks. 24 weeks is later than the first perception. 28 weeks. 28 weeks is much later. And the correct answer is 18 to 20 weeks. A primigravida first feels quickening at about 18 to 20 weeks. So, the right answer is option B. 18 to 20 weeks. Question 40. In pregnancy, the glomerular filtration rate increases by about option A, 10%. Option B, 25%. Option C, 50%. Option D, 75%. The correct answer is option C, 50%. Let's go through the options. 10%. 10% is too small a rise. 25%. 25% underestimates it. 75%. 75% overstates it. And the correct answer is 50%. The glomerular filtration rate rises by about 50% in pregnancy. So, the right answer is option C. 50%. Question 41. Amniocentesis is usually performed at option A, 8 to 10 weeks. Option B, 16 to 18 weeks. Option C, 24 to 26 weeks. Option D, 30 to 32 weeks. The correct answer is option B, 16 to 18 weeks. Let's go through the options. 8 to 10 weeks. 8 to 10 weeks is for chorionic villus sampling. 24 to 26 weeks. 24 to 26 is late for diagnosis. 30 to 32 weeks. 30 to 32 weeks is too late. And the correct answer is 16 to 18 weeks. Amniocentesis is done at 16 to 18 weeks. So, the right answer is option B. 16 to 18 weeks. Question 42. Postpartum hemorrhage is defined as blood loss exceeding Option A 300 milliliters. Option B 500 milliliters. Option C 800 milliliters. Option D 1000 milliliters. The correct answer is option B 500 milliliters. Let's go through the options. 300 milliliters. 300 milliliters is below the threshold. 800 milliliters. 800 is above the definition. 1000 milliliters. 1000 defines major hemorrhage. And the correct answer is 500 milliliters. Postpartum hemorrhage is blood loss over 500 milliliters. So, the right answer is option B. 500 milliliters. Question 43. The commonest site of endometriosis is the option A uterosacral ligament, option B pouch of Douglas, option C bladder, option D ovary. The correct answer is option D ovary. Let's go through the options. Uterosacral ligament. The uterosacral ligament is common but not the commonest. Pouch of Douglas. The pouch of Douglas is common but not the commonest. Bladder. The bladder is uncommon. And the correct answer is ovary. The ovary, forming chocolate cysts, is the commonest site. So, the right answer is option D. Ovary. Question 44. The commonest genital tuberculosis in the female involves the option A ovary, option B cervix, option C endometrium, option D fallopian tube. The correct answer is option D fallopian tube. Let's go through the options. Ovary. The ovary is involved later. Cervix. The cervix is uncommon. Endometrium. The endometrium is involved secondarily. And the correct answer is fallopian tube. The fallopian tube is the commonest site of female genital tuberculosis. So, the right answer is option D. Fallopian tube. Question 45. Asymmetric Moro reflex suggests option A cerebral palsy, option B Down syndrome, option C hypothyroidism, option D ERB palsy from brachial plexus injury. The correct answer is option D ERB palsy from brachial plexus injury. Let's go through the options. Cerebral palsy. Cerebral palsy affects tone more generally. Down syndrome. Down syndrome gives hypotonia, not asymmetry. Hypothyroidism. Hypothyroidism is not the cause. And the correct answer is ERB palsy from brachial plexus injury. An asymmetric Moro suggests ERB palsy from a brachial plexus injury. So, the right answer is option D. ERB palsy from brachial plexus injury. Question 46. Normal hemoglobin in a newborn at birth is about option A 10 to 12 grams per deciliter, option B 13.5 to 16.5 grams per deciliter, option C 18 to 20 grams per deciliter, option D 20 to 22 grams per deciliter. The correct answer is option B 13.5 to 16.5 grams per deciliter. Let's go through the options. 10 to 12 grams per deciliter. 10 to 12 is low for a newborn. 18 to 20 grams per deciliter. 18 to 20 is above this range. 20 to 22 grams per deciliter. 20 to 22 is too high. And the correct answer is 13.5 to 16.5 grams per deciliter. A newborn's hemoglobin is about 13.5 to 16.5. So, the right answer is option B. 13.5 to 16.5 grams per deciliter. Question 47. The normal respiratory rate of a 2 to 3-month-old infant is about. Option A, 20 per minute. Option B, 30 per minute. Option C, 40 per minute. Option D, 60 per minute. The correct answer is option C, 40 per minute. Let's go through the options. 20 per minute. 20 per minute is an adult rate. 30 per minute. 30 is low for a young infant. 60 per minute. 60 is the upper newborn limit. And the correct answer is 40 per minute. A 2 to 3-month infant breathes about 40 per minute. So, the right answer is option C. 40 per minute. Question 48. Bleeding disorder in the newborn is most commonly due to deficiency of. Option A, platelets. Option B, vitamin C. Option C, vitamin K. Option D, factor 8. The correct answer is option C, vitamin K. Let's go through the options. Platelets. Platelet deficiency is not the commonest cause. Vitamin C. Vitamin C is not the cause. Factor 8. Factor 8 deficiency is inherited hemophilia. And the correct answer is vitamin K. Hemorrhagic disease of the newborn is due to vitamin K deficiency. So, the right answer is option C. Vitamin K. Question 49. Croup is most commonly caused by. Option A, respiratory syncytial virus. Option B, parainfluenza virus. Option C, Haemophilus influenzae. Option D, adenovirus. The correct answer is option B, parainfluenza virus. Let's go through the options. Respiratory syncytial virus. Respiratory syncytial virus causes bronchiolitis. Haemophilus influenzae. Haemophilus influenzae causes epiglottitis. Adenovirus. Adenovirus is a less common cause. And the correct answer is parainfluenza virus. Parainfluenza virus is the commonest cause of croup. So, the right answer is option B. Parainfluenza virus. Question 50. Hemoptysis in a child is most commonly caused by. Option A, pertussis. Option B, tuberculosis. Option C, foreign body. Option D, bronchiectasis. The correct answer is option A, pertussis. Let's go through the options. Tuberculosis. Tuberculosis is a cause but less common. Foreign body. A foreign body is possible but not commonest. Bronchiectasis. Bronchiectasis is less common in children. And the correct answer is pertussis. Pertussis, with its violent cough, is the commonest cause of hemoptysis in children. So, the right answer is option A. Pertussis. Question 51. DPT vaccine is contraindicated in a child with. Option A, fever. Option B, malnutrition. Option C, diarrhea. Option D, convulsions. The correct answer is option D, convulsions. Let's go through the options. Fever. Mild fever is not a contraindication. Malnutrition. Malnutrition is not a contraindication. Diarrhea. Diarrhea is not a contraindication. And the correct answer is convulsions. A history of convulsions or encephalopathy contraindicates the pertussis component. So, the right answer is option D. Convulsions. Question 52. Meningitis in the newborn is most commonly caused by option A, group B streptococcus. Option B, Neisseria meningitidis. Option C, Haemophilus influenzae. Option D, Listeria only. The correct answer is option A, group B streptococcus. Let's go through the options. Neisseria meningitidis. Neisseria meningitidis affects older children. Haemophilus influenzae. Haemophilus affects unvaccinated infants, not neonates. Listeria only. Listeria is a cause but not the commonest. And the correct answer is group B streptococcus. Group B streptococcus is the commonest cause of neonatal meningitis. So, the right answer is option A. Group B streptococcus. Question 53. In kwashiorkor, which feature is characteristically absent? Option A, oedema. Option B, skin changes. Option C, marked muscle wasting. Option D, hepatomegaly. The correct answer is option C, marked muscle wasting. Let's go through the options. Oedema. Oedema is present in kwashiorkor. Skin changes. Skin changes are present. Hepatomegaly. Hepatomegaly is present. And the correct answer is marked muscle wasting. Marked muscle wasting is characteristically absent, unlike marasmus. So, the right answer is option C. Marked muscle wasting. Question 54. Bezold abscess points deep to the option A, digastric. Option B, trapezius. Option C, sternocleidomastoid. Option D, masseter. The correct answer is option C, sternocleidomastoid. Let's go through the options. Digastric. The digastric is not the point. Trapezius. The trapezius is not involved. Masseter. The masseter is unrelated. And the correct answer is sternocleidomastoid. A Bezold abscess points deep to the sternocleidomastoid. So, the right answer is option C. Sternocleidomastoid. Question 55. Ludwig angina involves which space? Option A, parapharyngeal. Option B, retropharyngeal. Option C, peritonsillar. Option D, submandibular. The correct answer is option D, submandibular. Let's go through the options. Parapharyngeal. The parapharyngeal space is separate. Retropharyngeal. The retropharyngeal space is separate. Peritonsillar. Peritonsillar is quinsy. And the correct answer is submandibular. Ludwig angina is a cellulitis of the submandibular space. So, the right answer is option D. Submandibular. Question 56. Quinsy is another name for option A, retropharyngeal abscess. Option B, Ludwig angina. Option C, parapharyngeal abscess. Option D, peritonsillar abscess. The correct answer is option D, peritonsillar abscess. Let's go through the options. Retropharyngeal abscess. A retropharyngeal abscess is different. Ludwig angina. Ludwig angina is submandibular. Parapharyngeal abscess. Parapharyngeal is a different space. And the correct answer is peritonsillar abscess. Quinsy is a peritonsillar abscess. So, the right answer is option D. Peritonsillar abscess. Question 57. A hot potato was suggests A. Option A, peritonsillar abscess. Option B, laryngeal tumor. Option C, nasal polyp. Option D, retropharyngeal abscess. The correct answer is option D, retropharyngeal abscess. Let's go through the options. Peritonsillar abscess. A peritonsillar abscess gives trismus and drooling. Laryngeal tumor. A laryngeal tumor changes the voice differently. Nasal polyp. A nasal polyp gives a nasal voice. And the correct answer is retropharyngeal abscess. A retropharyngeal abscess gives the muffled hot potato voice. So, the right answer is option D. Retropharyngeal abscess. Question 58. Acoustic neuroma most commonly arises from the Option A, inferior vestibular nerve. Option B, facial nerve. Option C, cochlear nerve. Option D, superior vestibular nerve. The correct answer is option A, inferior vestibular nerve. Let's go through the options. Facial nerve. The facial nerve is compressed, not the origin. Cochlear nerve. The cochlear nerve is affected later. Superior vestibular nerve. The superior vestibular nerve is a less common origin. And the correct answer is inferior vestibular nerve. The acoustic neuroma usually arises from the inferior vestibular nerve. So, the right answer is option A. Inferior vestibular nerve. Question 59. Laryngomalacia produces which epiglottic shape? Option A, absent. Option B, flattened. Option C, bifid. Option D, omega-shaped. The correct answer is option D, omega-shaped. Let's go through the options. Absent. An absent epiglottis is not the finding. Flattened. A flattened shape is not typical. Bifid. A bifid shape is not typical. And the correct answer is omega-shaped. Laryngomalacia gives an omega-shaped epiglottis. So, the right answer is option D. Omega-shaped. Question 60. Atrophic rhinitis is treated surgically by Option A, Caldwell-Look operation. Option B, septoplasty. Option C, Young operation. Option D, turbinectomy. The correct answer is option C, Young operation. Let's go through the options. Caldwell-Look operation. The Caldwell-Look operation is for the maxillary sinus. Septoplasty. Septoplasty corrects a deviated septum. Turbinectomy. Turbinectomy would worsen the dryness. And the correct answer is Young operation. The Young operation closes the nostril to treat atrophic rhinitis. So, the right answer is option C. Young operation. Question 61. The commonest cause of deafness overall is Option A, otosclerosis. Option B, chronic suppurative otitis media. Option C, presbycusis. Option D, wax. The correct answer is option B, chronic suppurative otitis media. Let's go through the options. Otosclerosis. Otosclerosis is a cause but not the commonest. Presbycusis. Presbycusis is age-related. Wax. Wax is common but reversible. And the correct answer is chronic suppurative otitis media. Chronic suppurative otitis media is the commonest cause of deafness overall. So, the right answer is option B. Chronic suppurative otitis media. Question 62. Nasopharyngeal carcinoma is most closely associated with option A, herpes simplex. Option B, human papillomavirus. Option C, cytomegalovirus. Option D, Epstein-Barr virus. The correct answer is option D, Epstein-Barr virus. Let's go through the options. Herpes simplex. Herpes simplex is not linked. Human papillomavirus. Human papillomavirus is linked to cervical cancer. Cytomegalovirus. Cytomegalovirus is not the cause. And the correct answer is Epstein-Barr virus. Nasopharyngeal carcinoma is strongly linked with Epstein-Barr virus. So, the right answer is option D. Epstein-Barr virus. Question 63. Phenytoin characteristically causes option A, renal stones. Option B, gingival hyperplasia. Option C, hepatic fibrosis. Option D, cataract. The correct answer is option B, gingival hyperplasia. Let's go through the options. Renal stones. Renal stones are not typical. Hepatic fibrosis. Hepatic fibrosis is not the classic effect. Cataract. Cataract is not caused by phenytoin. And the correct answer is gingival hyperplasia. Phenytoin causes gingival hyperplasia. So, the right answer is option B. Gingival hyperplasia. Question 64. The main dose-limiting toxicity of cyclophosphamide is option A, hemorrhagic cystitis. Option B, pulmonary fibrosis. Option C, cardiomyopathy. Option D, peripheral neuropathy. The correct answer is option A, hemorrhagic cystitis. Let's go through the options. Pulmonary fibrosis. Pulmonary fibrosis is from bleomycin or busulfan. Cardiomyopathy. Cardiomyopathy is from doxorubicin. Peripheral neuropathy. Peripheral neuropathy is from vincristine. And the correct answer is hemorrhagic cystitis. The acrolein metabolite of cyclophosphamide causes hemorrhagic cystitis. So, the right answer is option A. Hemorrhagic cystitis. Question 65. Methimazole may cause option A, agranulocytosis. Option B, aplastic anemia. Option C, hemolysis. Option D, thrombocytosis. The correct answer is option A, agranulocytosis. Let's go through the options. Aplastic anemia. Aplastic anemia is not typical. Hemolysis. Hemolysis is not typical. Thrombocytosis. Thrombocytosis is not caused. And the correct answer is agranulocytosis. Methimazole can cause agranulocytosis. So, the right answer is option A. Agranulocytosis. Question 66. Metronidazole may cause Option A. Nephrotoxicity. Option B. Optic neuritis. Option C. Agranulocytosis. Option D. Cardiotoxicity. The correct answer is option C. Agranulocytosis. Let's go through the options. Nephrotoxicity. Nephrotoxicity is not a feature. Optic neuritis. Optic neuritis is from ethambutol. Cardiotoxicity. Cardiotoxicity is not a feature. And the correct answer is agranulocytosis. Metronidazole can cause agranulocytosis. So, the right answer is option C. Agranulocytosis. Question 67. The antidote for arsenic poisoning is Option A. N-acetylcysteine. Option B. Naloxone. Option C. Desferrioxamine. Option D. Bal-dimercaprol. The correct answer is option D. Bal-dimercaprol. Let's go through the options. N-acetylcysteine. N-acetylcysteine is for paracetamol. Naloxone. Naloxone is for opioids. Desferrioxamine. Desferrioxamine is for iron. And the correct answer is Bal-dimercaprol. Bal-dimercaprol is the antidote for arsenic. So, the right answer is option D. Bal-dimercaprol. Question 68. Which drug is contraindicated in pregnancy? Option A. Tetracycline. Option B. Penicillin. Option C. Cephalexin. Option D. Paracetamol. The correct answer is option A. Tetracycline. Let's go through the options. Penicillin. Penicillin is safe. Cephalexin. Cephalexin is safe. Paracetamol. Paracetamol is safe. And the correct answer is tetracycline. Tetracycline stains fetal teeth and bones, contraindicated in pregnancy. So, the right answer is option A. Tetracycline. Question 69. Which drug secreted in breast milk is toxic to the neonate? Option A. Paracetamol. Option B. Chloramphenicol. Option C. Penicillin. Option D. Ibuprofen. The correct answer is option B. Chloramphenicol. Let's go through the options. Paracetamol. Paracetamol is safe in breastfeeding. Penicillin. Penicillin is safe. Ibuprofen. Ibuprofen is safe. And the correct answer is chloramphenicol. Chloramphenicol in milk can cause grey baby syndrome. So, the right answer is option B. Chloramphenicol. Question 70. The drug of choice in anaphylaxis is Option A. Hydrocortisone. Option B. Chlorpheniramine. Option C. Adrenaline. Option D. Salbutamol. The correct answer is option C. Adrenaline. Let's go through the options. Hydrocortisone. Hydrocortisone acts too slowly. Chlorpheniramine. Chlorpheniramine is an adjunct antihistamine. Salbutamol. Salbutamol only helps bronchospasm. And the correct answer is adrenaline. Adrenaline is the first-line drug in anaphylaxis. So, the right answer is option C. Adrenaline. Question 71. Torsades de points is treated with Option A. Digoxin. Option B, amiodarone. Option C, magnesium sulfate. Option D, verapamil. The correct answer is option C, magnesium sulfate. Let's go through the options. Digoxin. Digoxin can worsen it. Amiodarone. Amiodarone prolongs the QT further. Verapamil. Verapamil is not the treatment. And the correct answer is magnesium sulfate. Magnesium sulfate is the treatment for Torsades de Pointes. So, the right answer is option C. Magnesium sulfate. Question 72. The most powerful refractive surface of the eye is the Option A, posterior surface of the cornea. Option B, anterior lens surface. Option D, posterior lens surface. The correct answer is option C, anterior surface of the cornea. Let's go through the options. Posterior surface of the cornea. The posterior corneal surface is weakly refractive. Anterior lens surface. The anterior lens is less powerful than the cornea. Posterior lens surface. The posterior lens is less powerful. And the correct answer is anterior surface of the cornea. The ear-cornea interface, the anterior corneal surface, is the most powerful. So, the right answer is option C. Anterior surface of the cornea. Question 73. Astigmatism is characteristically associated with Option A, keratoconus. Option B, cataract. Option C, glaucoma. Option D, retinal detachment. The correct answer is option A, keratoconus. Let's go through the options. Cataract. Cataract clouds the lens. Glaucoma. Glaucoma raises pressure. Retinal detachment. Retinal detachment is a retinal problem. And the correct answer is keratoconus. Keratoconus, an irregular cone-shaped cornea, causes astigmatism. So, the right answer is option A. Keratoconus. Question 74. Posterior staphyloma is a feature of Option A, astigmatism. Option B, high myopia. Option C, presbyopia. Option D, hypermetropia. The correct answer is option B, high myopia. Let's go through the options. Astigmatism. Astigmatism is a corneal curvature. Presbyopia. Presbyopia is age-related lens stiffening. Hypermetropia. Hypermetropia is a short eye. And the correct answer is high myopia. Posterior staphyloma is a feature of high myopia. So, the right answer is option B. High myopia. Question 75. The commonest type of cataract in children is Option A, nuclear. Option B, cortical. Option C, lamellar. Option D, posterior subcapsular. The correct answer is option C, lamellar. Let's go through the options. Nuclear. Nuclear cataract is not the commonest in children. Cortical. Cortical cataract is age-related. Posterior subcapsular. Posterior subcapsular is steroid or drug-related. And the correct answer is lamellar. Lamellar or zonular cataract is the commonest in children. So, the right answer is option C. Lamellar. Question 76. Central retinal vein occlusion classically shows on fundoscopy. Option A, cherry red spot. Option B, blot and dot hemorrhages. Option C, attenuated arteries. Option D, optic atrophy. The correct answer is option B, blot and dot hemorrhages. Let's go through the options. Cherry red spot. A cherry red spot is seen in artery occlusion. Attenuated arteries. Attenuated arteries suggest artery occlusion. Optic atrophy. Optic atrophy is a late, non-specific sign. And the correct answer is blot and dot hemorrhages. Vein occlusion gives blot and dot hemorrhages, the blood and thunder fundus. So, the right answer is option B. Blot and dot hemorrhages. Question 77. The effective treatment of dendritic corneal ulcer is option A, acyclovir. Option B, steroid drops. Option C, atropine. Option D, antibiotic ointment. The correct answer is option A, acyclovir. Let's go through the options. Steroid drops. Steroid drops would worsen herpes. Atropine. Atropine only dilates the pupil. Antibiotic ointment. Antibiotic ointment does not treat a virus. And the correct answer is acyclovir. A dendritic ulcer is herpetic and treated with acyclovir. So, the right answer is option A. Acyclovir. Question 78. Nasolacrimal duct opens into the option A, superior meatus. Option B, middle meatus. Option C, sphenoethmoidal recess. Option D, inferior meatus. The correct answer is option D, inferior meatus. Let's go through the options. Superior meatus. The superior meatus drains the posterior ethmoid sinuses. Middle meatus. The middle meatus drains most sinuses. Sphenoethmoidal recess. The sphenoethmoidal recess drains the sphenoid. And the correct answer is inferior meatus. The nasolacrimal duct opens into the inferior meatus. So, the right answer is option D. Inferior meatus. Question 79. Optic nerve glioma is most commonly associated with option A, neurofibromatosis type 1. Option B, tuberous sclerosis. Option C, von Hippel-Lindau. Option D, Sturge-Weber. The correct answer is option A, neurofibromatosis type 1. Let's go through the options. Tuberous sclerosis. Tuberous sclerosis gives other tumors. Von Hippel-Lindau. Von Hippel-Lindau gives Hemann. Sturge-Weber. Sturge-Weber gives a port wine stain. And the correct answer is neurofibromatosis type 1. Optic nerve glioma is associated with neurofibromatosis type 1. So, the right answer is option A. Neurofibromatosis type 1. Question 80. Reed-Sternberg cells are characteristic of option A, chronic lymphocytic leukemia. Option B, non-Hodgkin lymphoma. Option C, multiple myeloma. Option D, Hodgkin lymphoma. The correct answer is option D, Hodgkin lymphoma. Let's go through the options. Chronic lymphocytic leukemia. Chronic lymphocytic leukemia has smear cells. Non-Hodgkin lymphoma. Non-Hodgkin lymphoma lacks Reed-Sternberg cells. Multiple myeloma. Myeloma has plasma cells. And the correct answer is Hodgkin lymphoma. Reed-Sternberg cells are diagnostic of Hodgkin lymphoma. So, the right answer is option D. Hodgkin lymphoma. Question 81. A hamartoma is best described as option A. A malignant tumor. Option B. A benign neoplasm. Option C. A developmental malformation. Option D. An inflammatory mass. The correct answer is option C. A developmental malformation. Let's go through the options. A malignant tumor. It is not malignant. A benign neoplasm. It is not a true neoplasm. An inflammatory mass. It is not inflammatory. And the correct answer is a developmental malformation. A hamartoma is a disorganized overgrowth of native tissue, a developmental malformation. So, the right answer is option C. A developmental malformation. Question 82. Consumptive coagulopathy is another term for option A. Von Willebrand disease. Option B. Hemophilia. Option C. Thrombocytopenic purpura. Option D. Disseminated intravascular coagulation. The correct answer is option D. Disseminated intravascular coagulation. Let's go through the options. Von Willebrand disease. Von Willebrand disease is inherited. Hemophilia. Hemophilia is a factor deficiency. Thrombocytopenic purpura. Thrombocytopenic purpura is platelet destruction. And the correct answer is disseminated intravascular coagulation. Disseminated intravascular coagulation consumes clotting factors, a consumptive coagulopathy. So, the right answer is option D. Disseminated intravascular coagulation. Question 83. Nevus flammeus, port wine stain, is a type of option A. Nevus cell tumor. Option B. Lymphangioma. Option C. Fibroma. Option D. Hemangioma. The correct answer is option D. Hemangioma. Let's go through the options. Nevus cell tumor. A nevus cell tumor is a mole. Lymphangioma. A lymphangioma is lymphatic. Fibroma. A fibroma is fibrous. And the correct answer is hemangioma. A port wine stain is a capillary hemangioma. So, the right answer is option D. Hemangioma. Question 84. A Warthin tumor characteristically arises in the option A. Thyroid. Option B. Submandibular gland. Option C. Parotid gland. Option D. Sublingual gland. The correct answer is option C. Parotid gland. Let's go through the options. Thyroid. The thyroid is unrelated. Submandibular gland. The submandibular gland is not the usual site. Sublingual gland. The sublingual gland is rarely involved. And the correct answer is parotid gland. A Warthin tumor arises in the parotid gland. So, the right answer is option C. Parotid gland. Question 85. Heinz bodies in a blood film indicate option A. G6PD deficiency. Option B. Iron deficiency. Option C. Thalassemia. Option D. Sideroblastic anemia. The correct answer is option A. G6PD deficiency. Let's go through the options. Iron deficiency. Iron deficiency gives microcytosis. Thalassemia. Thalassemia gives target cells. Sideroblastic anemia. Sideroblastic anemia gives ring sideroblasts. And the correct answer is G6PD deficiency. Heinz bodies, denatured hemoglobin, indicate G6PD deficiency. So, the right answer is option A. G6PD deficiency. Question 86. In an epidemic, the term endemic means a disease that is option A. Constantly present in a particular population. Option B. Spread over several countries. Option C. Newly introduced. Option D. Eradicated. The correct answer is option A. Constantly present in a particular population. Let's go through the options. Spread over several countries. Spread over countries is pandemic. Newly introduced. Newly introduced is not endemic. Eradicated. Eradicated is the opposite. And the correct answer is constantly present in a particular population. Endemic means a disease constantly present in a population. So, the right answer is option A. Constantly present in a particular population. Question 87. Chemical sympathectomy is performed using option A. 5% phenol. Option B. 10% formalin. Option C. Absolute alcohol only. Option D. Normal saline. The correct answer is option A. 5% phenol. Let's go through the options. 10% formalin. 10% formalin is a fixative. Absolute alcohol only. Absolute alcohol is used elsewhere. Normal saline. Normal saline is inert. And the correct answer is 5% phenol. Chemical sympathectomy uses about 5% phenol. So, the right answer is option A. 5% phenol. Question 88. Insensible water loss in an adult per day is about option A. 200 to 400 milliliters. Option B. 600 to 1500 milliliters. Option circa 2000 to 2500 milliliters. Option D. 3000 milliliters. The correct answer is option B. 600 to 1500 milliliters. Let's go through the options. 200 to 400 milliliters. 2 to 400 is too low. 2000 to 2500 milliliters. 2 to 2500 is too high. 3000 milliliters. 3000 is far too high. And the correct answer is 600 to 1500 milliliters. Insensible water loss is about 600 to 1500 milliliters a day. So, the right answer is option B. 600 to 1500 milliliters. Question 89. Fluoride poisoning occurs when drinking water contains more than option A. 1 ppm. Option B. 5 ppm. Option C. 10 ppm. Option D. 20 ppm. The correct answer is option C. 10 ppm. Let's go through the options. 1 ppm. 1 part per million is the safe level. 5 ppm. 5 parts per million is below the stated threshold. 20 ppm. 20 parts per million is above the threshold. And the correct answer is 10 ppm. Fluoride poisoning occurs above 10 parts per million. So, the right answer is option C. 10 ppm. Question 90. The prophylactic dose of tetanus immunoglobulin is Option A, 100 international units. Option B, 250 international units. Option C, 500 international units. Option D, 1000 international units. The correct answer is option B, 250 international units. Let's go through the options. 100 international units. 100 units is below the dose. 500 international units. 500 units is for high-risk cases. 1000 international units. 1000 units is a treatment dose. And the correct answer is 250 international units. The prophylactic dose of tetanus immunoglobulin is 250 units. So, the right answer is option B, 250 international units. Question 91. Vital capacity is defined as the maximum volume of air. Option A, expired after a full inspiration. Option B, inspired after a normal breath. Option C, remaining after full expiration. Option D, moved during quiet breathing. The correct answer is option A, expired after a full inspiration. Let's go through the options. Inspired after a normal breath. Air inspired after a normal breath is the inspiratory reserve. Remaining after full expiration. Air remaining after full expiration is the residual volume. Moved during quiet breathing. Air moved in quiet breathing is the tidal volume. And the correct answer is expired after a full inspiration. Vital capacity is the maximum air expired after a full inspiration. So, the right answer is option A, expired after a full inspiration. Question 92. The human body stores enough oxygen for about Option A, 2 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 60 minutes. The correct answer is option C, 30 minutes. Let's go through the options. 2 minutes. 2 minutes underestimates the stores. 10 minutes. 10 minutes is short of the stated value. 60 minutes. 60 minutes overstates it. And the correct answer is 30 minutes. The body stores enough oxygen for about 30 minutes. So, the right answer is option C, 30 minutes. Question 93. Endolymph is secreted by the Option A, cochlear blood flow. Option B, stria vascularis. Option C, choroid plexus. Option D, ciliary body. The correct answer is option B, stria vascularis. Let's go through the options. Cochlear blood flow. Cochlear blood flow does not secrete it. Choroid plexus. The choroid plexus makes cerebrospinal fluid. Ciliary body. The ciliary body makes aqueous humor. And the correct answer is stria vascularis. Endolymph is secreted by the stria vascularis. So, the right answer is option B, stria vascularis. Question 94. The number of nephrons in one kidney is about Option A, 100,000. Option B, 500,000. Option C, 5 million. Option D, 1 million. The correct answer is option D, 1 million. Let's go through the options. 100,000, 100,000 is too few. 500,000? 500,000 is half. 5 million. 5 million is far too many. And the correct answer is 1 million. Each kidney has about 1 million nephrons. So, the right answer is option D. 1 million. Question 95. Primary cartilaginous joints are exemplified by the option A. Costochondral joints. Option B. Pubic symphysis. Option C. Intervertebral discs. Option D. Sacroiliac joint. The correct answer is option A. Costochondral joints. Let's go through the options. Pubic symphysis. The pubic symphysis is secondary cartilaginous. Intervertebral discs. Intervertebral discs are secondary cartilaginous. Sacroiliac joint. The sacroiliac joint is synovial. And the correct answer is costochondral joints. The costochondral joints are primary cartilaginous. So, the right answer is option A. Costochondral joints. Question 96. The joint between the two pubic bones is the option A. Sacrococcygeal joint. Option B. Sacroiliac joint. Option C. Hip joint. Option D. Pubic symphysis. The correct answer is option D. Pubic symphysis. Let's go through the options. Sacrococcygeal joint. The sacrococcygeal joint is elsewhere. Sacroiliac joint. The sacroiliac joint is between sacrum and ilium. Hip joint. The hip joint is the femur and acetabulum. And the correct answer is pubic symphysis. The pubic symphysis joins the two pubic bones. So, the right answer is option D. Pubic symphysis. Question 97. The chorda tympani passes between which two ossicles? Option A. Stapes and oval window. Option B. Incus and stapes. Option C. Malleus and incus. Option D. Malleus and tympanic membrane. The correct answer is option C. Malleus and incus. Let's go through the options. Stapes and oval window. The stapes and oval window is not the site. Incus and stapes. Between incus and stapes is wrong. Malleus and tympanic membrane. Between malleus and eardrum is wrong. And the correct answer is malleus and incus. The chorda tympani passes between the malleus and the incus. So, the right answer is option C. Malleus and incus. Question 98. The lower limit of the pharynx corresponds to which vertebral level? Option A. C4. Option B. C6. Option C. T1. Option D. T4. The correct answer is option B. C6. Let's go through the options. C4. C4 is higher up. T1. T1 is too low. T4. T4 is far too low. And the correct answer is C6. The pharynx ends at C6 becoming the oesophagus. So, the right answer is option B. C6. Question 99. The vitamin K dependent clotting factors are option A. I, V, 8, 13. Option B. 2, 7, 9, X. Option C. 3, 4, 11, 12. Option D. V, 8, 11, 13. The correct answer is option B. 2, 7, 9, X. Let's go through the options. IV 8, 13. 1, 5, 8 and 13 are not the vitamin K factors. 3, 4, 11, 12. 3, 4, 11 and 12 are not. V 8, 11, 13. 5, 8, 11 and 13 are not. And the correct answer is 2, 7, 9, X. Factors 2, 7, 9 and 10 are vitamin K dependent. So, the right answer is option B. 2, 7, 9, X. Question 100. Increased hydroxyproline excretion reflects turnover of option A. Myosin, option B. Elastin, option C. Keratin, option D. Collagen. The correct answer is option D. Collagen. Let's go through the options. Myosin. Myosin turnover is not measured this way. Elastin. Elastin is not the main source. Keratin. Keratin is a skin and hair protein. And the correct answer is collagen. Hydroxyproline excretion reflects collagen turnover. So, the right answer is option D. Collagen.